Moving away, patients, particularly at Federal Medical Center and other government hospitals across Bayelsa State, were left stranded as nurses under the umbrella of National Association of Nurses and Midwives warning strike enters day 2. The strike, which followed the expiration of 15-day ultimatum issued by the union, has continued to ground healthcare services in Federal Medical Center and other health institutions in the state. Our Bayelsa State Correspondent Achinonu Temple reports that only doctors were seen performing both duties of doctors and nurses in this report.
The face-off between the nurses across the nation and the federal government over certain demands bordering mainly on better welfare of the workers is gradually disrupting medical services in government hospitals. At the FMC in Yenegua, patients were seen sitting on waiting rooms without any nurse on ground attending to them. Many who waited for the nurses without receiving any attention had to go back home if enough resources are not available to access private hospitals.
Nurses are not available to attend to patients, but the doctors are doing the job of the nurses, and they are the one attending to patients, taking their details, and also checking up the patients. So, of course, when the number of personnel are few, definitely it is going to lead to delay.
From the waiting room to male and female wards, orthopedic, emergency, pediatric to general outpatient units were all deserted by the nurses. Only the cleaners, security guards, pharmacists, and doctors were seen attending to patients. The situation had led many patients on admission, mostly in the pediatric unit, to be discharged as few patients left had to help themselves.
Supposed to be taking a tablet given by the nurse, but because the nurses are not on ground, I was able to. They asked me to do that, and right now you saw me after removing the plaster, I was able to clean the wound, which is not supposed to be my job.
Services like boiling water, provision shop, akamu. So they've discharged all our customers. Hungry is killing us like that. I want the best nurses to come back.
Some nurses seen at the medical facility to enforce their national decision gave reasons for their warning strike.
We have the right to have our own scheme of service. What are they waiting for to gazette it? So it will be an official document. Secondly, implementation of the National Industrial Court judgment of January 2012. Upward review of our professional allowances for both nurses and midwives. Employment of nursing personnel and adequate provision of health facilities. Centralization of our nursing interns.
We have 9-point agenda. They are very simple, very, very simple. The government should make sure that those points are being addressed. What is good for A should also be good for B.
According to the nurses, the government should prepare for another 21-day warning strike and perhaps indefinite strike if their demands are not met. Achinonu Temple, ADBN News.